The Rehabilitation Institute here at Palmdale Regional Medical Center is one of a kind. We are the only inpatient rehab unit in Palmdale and Lancaster and Antelope Valley. We offer inpatient rehab services and outpatient rehab services for patients requiring inpatient and outpatient rehab. These patients could include, but are not limited to, persons who've had stroke, spinal cord injury, traumatic brain injury, functional debility secondary to surgical procedures, as well as individuals who've had exacerbations of comorbid medical conditions that end up with significant functional ability that is enabling and makes it difficult for them to go home. In rehab, we'd like to think that when a patient comes to an acute inpatient rehab facility, that facility is close to their home. And when it's close to their home, the loved ones are able to get involved with the rehab process. That's very important as we try to facilitate a disposition back to community. We do that quite well here. If you were to compare our discharge to community to the nation, we do much better than the nation. And so of all the patients that come into our facility, over 80% of them end up back in the community. I would say that I'm most proud of the passion that the staff here on the unit have. The nursing staff, the therapy staff, the case management staff, the environment of care staff are very in tune to doing what's right by our patients and making sure that our patients are number one when it comes to providing supportive care for them while they're here on the unit. We've certainly been challenged by COVID-19 and the pandemic. We pride ourselves on following both the CDC and LA County guidelines. We are required to wear masks throughout the unit while we're caring for patients. We also wear PPE. We also require social distancing and encourage washing hands as often as possible. So we're very in tune to this pandemic being real, being a problem that we deal with each and every day, and making sure that we're doing our very best to meet both CDC and LA County guidelines. You know, over the course of the last 2 years, I've been very privileged to see some patients actually have miracles while here on the unit. We've had patients that have come to the unit unable to speak, unable to move their arms, unable to ambulate, unable to bathe themselves, unable to toilet themselves. And with the passionate care that has been rendered by the caregivers here on the unit, they have actually experienced miracles. They walked off of our unit. They've returned home in the loving care of their loved ones and supportive caregivers. So that's really a testament to both the patient population that has engaged in rehab as well as the clinicians here that provide such supportive care.